Hi everyone, how are you all? Today I'm going to discuss about renal tumors, that is a subtopic from the genitourinary problems. First of all, do you have any idea about this genitourinary problems or disease? Definition of renal tumors. Renal tumors are the non-cancerous growths of the kidneys that do not metastasize to other sites in the body. If we compare to other disease conditions or other tumors, what happens if the disease condition occurs later in chronic stages, it completely spread to other parts of the body. Whereas in renal tumors, here what happens, the non-cancerous growths, the non-cancerous cells, whatever produced, it inculcates. If we observe this cut section of the kidney, non-cancer risk factors, tobacco smoking, environmental exposure, occupational history, hormonal, obesity, and acquired polycystic kidney disease. In case of all these risk factors, what happens if we are continuously exposed to any stress or any other life events or environmental exposure or tobacco smoking? In case the cancerous cells, whatever produced in the kidney, it used to multiply itself and produces the classification of the renal tumor. It is mainly subdivided into benign and malignant. In case of benign, it is of cyst, leiomyoma, lipoma, hemangioma, angiomyolipoma, adenoma, and the juxtaglomerular cell tumor. Whereas in malignant, it is of renal cell carcinoma, transitional cell carcinoma, oncocytoma, sarcoma, lymphoma, and the metastasis. In case of benign, if the leiomyoma exists, it is a rare benign mesenchymal tumor of the kidney, where it arises from the smooth muscle fibers of the three structures, such as three structures will be there, no? Renal capsule, renal pelvis, or other vascular structures. From that it arises. That is the leiomyoma. Next, lipoma. Lipoma means actually it originates in the fat cells itself. Within the renal capsule or surrounding tissue, it rises. Next, hemangioma. Hemangioma, to observe, it is clinically silent, but the main symptom is hematuria. Sometimes it may be profuse, and sometimes it may be relapsed stage. Next, angiomyolipoma. It is a type of kidney tumor. It mainly consists of three components such as fat, muscles, blood vessels. Like that, it comprises of all these things. Next, adenoma. Adenoma means what? Adenoma means it is a single or multiple yellowish grey nodules that is within the renal cortex. We can observe here within the renal cortex this adenoma happens. Next, juxtaglomerular cell tumor. This is a unusual mesenchymal entity of the kidney. There will be no complete exposure of the kidney. Here it is an unusual formation. Whereas malignant, the renal cell carcinoma, it involves the mainly malignant cells which are found in the kidney lining tubules will be there. In that we can easily observe this renal cell carcinoma. Next, transitional cell carcinoma. Here the malignant cells will be formed in the renal pelvis or ureter, and it gradually spreads to the renal structures. Next one, oncocytoma. It is a mahogany colored mass with a central stellate scar, or it is a well circumscribed tan. The oncocytoma completely exhibits its clinical feature, sarcoma. Sarcoma means it is a type of cancer. Mainly it is developed within the bone or the soft tissue of the body. The soft tissue, what was the soft tissue? It includes cartilage, fat, muscles, blood vessels, and other fibrous tissues. These are all the structures which involves in the soft tissue of the body. Next, lymphoma. Lymphoma means it is a cancer of the lymphatic system. which is a part of the disease. Whatever the germ fighting system was there, it induces the lymphatic system and it improves our immunity. But in case of this renal tumor, it completely affects. Finally, metastasis. Metastasis means the cancer cells, whatever was there, it spread to different parts of the body parts than where it started. From starting point to other all parts of the body, it completely spread it. We can observe the signs and symptoms. It is mainly classic triad. We can call it as a classic triad because these three main features it involves in renal tumors: hematuria, flank pain and the abdominal mass. If we are going to ask the patient regarding the clinical manifestations, they will complain that there is a blood in the urine and continuously complaining of flank pain, and they may feel some mass over the abdomen. There they will feel like some hard structure was there on the abdomen, like that they used to complain us. With that symptoms, we can easily diagnose the condition. What are the signs of see these renal tumors? By malaise, weight loss and anorexia. Due to the cancer cells, there will be malaise. Malaise means it is a discomfort or unease whose exact cause is difficult to identify. There we can't identify what was the exact reason that patient is feeling discomfort. Next, abnormal urine color. Hematuria will be there. Next, polycythemia. Polycythemia means it is an abnormally high number of red blood cells. Complete, there will be high production of RBC in the blood, and it is as considered as a primary disease or secondary condition of renal tumors. Next, anemia. There will be the complete blood loss or reduction in the production of RBC. Next, fracture of hip, varicocele. As there is a depletion in the production of calcium, there will be risk to get the fractures. Next, varicocele. Varicocele means here, if in case of metastasis, what happens? There will be the enlargement of the veins within the loose bag of the skin that holds the scrotum. So, what happens in case of scrotal swelling and all? The enlargement of veins will be there. So, the varicocele may exist. Next one, hirsutism. Hirsutism means there will be an abnormal growth of hair on a woman's face or body. If we observe the woman's body, there will be the abnormal excessive hair growth. Next, constipation, hypertension, hypercalcemia. There will be increase in the calcium levels that is above the normal level. Final one, leg and ankle swelling. These are all the clinical manifestations we can observe in case of renal tumors. How this renal cell carcinoma go for treatment process? Based on the size. If the size is below 4 centimeters, there will be small renal mass protocol. Otherwise, there will be we need to observe the patient characteristics for comorbidity, lifespan improval, age, review of imaging or staging. If in case of recovery and all, they may go for palliative care. There will be poor functional ability, not a surgical candidate if the patient can't go for surgery due to any other conditions or serious life-limiting comorbidities. If there is a serious life-limiting conditions, they can go for the cryoablation or the radioablation. Cryoablation is a procedure in which here what happens, the extremely cold liquid or the instrument called the cryoprobe is used to freeze and destroy the abnormal tissue. Whatever the abnormal tissue, we freeze continuously by using cryoprobe, that is the cryoablation. Then by reviewing these patient characteristics, we need to go for partial nephrectomy, radical nephrectomy. If in case of partial nephrectomy, if the patient is having multiple renal tumors, genetic cancer syndrome, solitary kidney or chronic kidney disease stage 3 or higher. Solitary kidney, in case of the solitary kidney, what happens in here? There is a single kidney. Instead of two kidneys, only there will be single kidney. In case of all these conditions, they may go for partial nephrectomy. But in case of extension into the perirenal fat, ipsilateral adrenal gland or renal vein or local lymph nodes or large tumors, or by using the partial nephrectomy, if it can't be helpful, we need to go for, first of all, we need to assess the patient for clinical manifestations. Whatever the clinical symptoms the patient is facing, we need to observe them and we need to identify them early. If the patient is suffering with hematuria, anemia, or any other patient is complaining, we need to observe carefully and we need to monitor the condition and immediately need to inform to the physician regarding the clinical manifestations, whatever we observed. Then assess the cardiopulmonary and the nutritional status. With the disease condition affected process, the complete nutrition of the person will be affected easily. So we need to concentrate continuously on the nutritional status so that they need to take good nutrition while having the treatment process. Next, assess the cardiopulmonary and the nutritional status. Here what happens, the nutrition status will be affected easily. So we need to observe carefully regarding the nutrition pattern, how the patient is suffering. If any abnormalities are present, like that we need to observe carefully. Then monitor for the adverse effects. If the patient had undergone any partial nephrectomy or radical nephrectomy, or the complete metastasis happens, or any other palliative care, there will be so many other symptoms which will easily affect. And in view of patient care, we need to observe all the adverse effects of chemo or radiation therapy, and according to that we need to explain the patient regarding all the situations, whatever. During these renal tumors, there will be excess pain. So we need to explain the patient to maintain calm and quiet, comfortable environment and make use of analgesics and completely to take the rest. And in case of any elevated condition or elevated risk or elevated pain, physician relaxation techniques like listening music or motivational methods, by following the motivational methods. Nursing diagnosis. Mainly two nursing diagnoses we can identify: anxiety related to the diagnosis of cancer and in case of anxiety due to the diagnosis of cancer, we need to support the patient. We need to give psychological support and counseling to the patient and family members, and we need to identify the early signs and symptoms. Regarding the disease condition, we need to explain, and whatever the treatment modalities are available to the patient, we need to explain to the patient and the patient attenders so that they can recover quickly. Then acute pain and hyperthermia related to post-infection syndrome. Due to this renal tumors, there will be the increased risk. The pain measures, the pain relief measures, whatever available, and to reduce the fever and all, the cold sponge will be given, and antipyretics and continuous bed rest. It helps to reduce this complication. Nursing interventions in case of post-infection syndrome. We need to control the symptoms not to get into the infection condition. So we need to monitor continuously regarding the signs and symptoms of the disease condition, and we need to treat according to the signs and symptoms whatever. With this today's session, we had seen all the clinical manifestations, classification,